Hello, and welcome to today's webinar, The 1000 Days That Matter Most, Natural Strategies for Healthy Mums and Babies by the Paediatric Naturopath. So your presenters today are Lisa Moan and Sarah Pretorius. So I'm Lisa and I'm the founder of the Paediatric Naturopath. So I'm a degree qualified naturopath specializing in children's health. And we at the Paediatric Naturopath, we support children with eczema, allergies, gut issues, behavioral issues, all sorts of things. And we really want to help families build strong foundations in the first 1000 days, which is the purpose of our webinar today. And joining me today is one of our wonderful naturopaths, Sarah Pretorius. So Sarah is also a degree qualified naturopath and a mother, and she's got over 12 years experience with working with children's health. And she's also just completed a course called the Natural Early Life course with the Microbiome Restoration Centre. So she's one of the few naturopaths in Australia who has done really, really extensive training on the microbiome when it comes to babies, because babies are not small adults. And so this is the team at the Paediatric Naturopath. As you can see, there's a few of us. Oh, there's a few of us in the team at the Paediatric Naturopath. So we've got naturopaths, nutritionists, dietitians. Not pictured. We also have an oral myofunctional therapist. So we have the full suite of practitioners in the team. So what we're going to discuss today are what are the first 1000 days? What do we mean by this? Common challenges mums and babies face, what a naturopathic approach to each phase of the 1000 days looks like. And then we're going to introduce our 1000 days journey membership. And this is just one of the beautiful little children that I helped quite a long time ago. Mum was very overwhelmed with starting solids, as so many mums are, and constipation was proving a problem. And some naturopathic advice meant that this problem was solved easily and quickly. And, this baby didn't have to go down the path of just using laxatives for the next few years.
Okay, so what is the 1000 days journey? So the concept of the 1000 days is really based on the concept of the developmental origins of health and disease. And that was first sort of started in the 1980s when some researchers found that when going through medical records that little baby boys who were born with a lower birth weight had much higher chances of having heart disease later on in life. And so that early research led to the DOHAD, which is the Developmental Origins of Health and Disease. And there's a lot of ongoing research in that space, which really highlights the importance of that first 1000 days for optimizing health outcomes later on in life. So the 1000 day journey is our offering to you based on some of that research and what we're seeing day to day and through research. And we're really combining all of that with our evidence-based naturopathic care to support you for that time because we can see and we know from all of that research and from our experience that this time really does matter. And so the first 1000 days are from conception to your child's second birthday. And we do include preconception in our journey because we recognize, obviously, that that moment of conception, what happens before that in terms of the sperm and the egg health and all of the things that parents do to prepare can really affect the health of that embryo. And we also recognize that preparing for pregnancy and that preconception time really does improve outcomes. And so usually when people are thinking about having a baby or if they're planning, to start a family for the first time or grow their family, they often they often aren't thinking about things other than the excitement of having a family, unless, of course, they've had a child who has had allergies or immune issues or behavioral issues. And so these are some of the surprising stats and facts that we kind of will often reflect on when we're sort of planning to help people in this stage. And so 10% of Australian babies actually have a food allergy by their first birthday, which is quite a high rate and one of the highest rates in the world, actually. And in Australia, only about 30%, 37% of babies, so 1/3 of babies, are exclusively breastfed for the recommended 6 months. We also see quite high rates of autism spectrum, and also there is an understanding that these rates will get much higher. We know that the low birth weight predicts adult health disease, and we also know that current health and gut health and microbiome does have quite a major effect on pregnancy outcomes. And so the overarching kind of thing that I would like to sort of express today is that reproduction requires significant resources. And, in an ideal world, we would have all of our nutrient needs met and low stress, no toxins. But unfortunately, the case that we see time and time again is that women are going into pregnancy and postpartum with nutrient insufficiency, quite demanding workloads, being in isolated, smaller families. And there's also a lot of toxins in our environment, as well as just a lot of information to sift through, and it can be a really quite challenging to kind of meet all your needs and have to deal with all of this stuff as well. And so this picture is the top line is kind of what we expect when we have our baby from preconception to the first 2 years. But what's going on underneath this, I just wanted to illustrate, is that during this time, it's really a time of rapid development and adaptation to the environment. So, you sort of see yourself getting a positive pregnancy test, suddenly you're pregnant, then, you're going through all of those stages. But an example of something that's going on underneath is that often people are quite stressed in pregnancy. And we know that stress in pregnancy actually alters your baby's stress response. So they're more likely to be more reactive. So you might see more difficulty settling, more sensory sensitivities. And research has shown that actually stress in pregnancy can also lead to more anxiety and ADHD. So there really is a domino effect throughout this time. What happens in preconception will affect pregnancy. What happens in pregnancy will affect birth, and so on. And we're here because many of these things are modifiable, and many of these risks we can change. And so the information is out there, but it's hard to sift through, and it's often contradictory. And things are often moving fast. There's so many ideas, and it's just more important than ever to know that there are things you can do. And so by the end of the session, I'd really like for you to be able to identify specific things you can do at each stage of your journey, wherever you are at the moment, to help your future child thrive, or your current child. And so this is what we're going to be discussing today. So I've sort of divided it into 4 separate time zones. So when you're trying to conceive in the first trimester, the second and third stages of pregnancy, and then your baby's first year and their second year. And then underlying all of this is the 4 core factors that we're trying to support throughout that time. And so I'm just going to go into some of these 4 core factors just in a bit more detail. So when you look at epigenetics, our aims here are to create healthy environments for positive gene expression. So a healthy environment in preconception and trimester 1 is different to the baby's first year, but they're all still very relevant, and epigenetic changes can occur throughout. And so the aim with the microbiome is to support the microbiome to be diverse and anti-inflammatory, and that's in the case of the gut microbiome, And so that's been shown to be have the best outcomes for immune system development and also for pregnancy outcomes. And then with immune signaling, that's something that people aren't often thinking about, but that's really how the immune system develops. And it starts right at the beginning in preconception and during pregnancy. It's actually programmed through interactions between genetics, what's happening with a mum during pregnancy, everything she's exposed to, and how well she's eating or what her nutrient levels are. So immune signaling in pregnancy is obviously a little bit different to what's happening in baby's first year. And each period has quite little, I guess, different demands or different requirements to help support that specific factor. And then in neuroplasticity, our aim is to provide a stable, nourishing environment that promotes healthy brain wiring. So this can look different at preconception to how it looks in the first and second year. But in the first and second year, we're really sort of aiming for responsive caregiving, good nutrition, and really healthy microbiome as well. And so just another pictorial here, and I don't want to spend too much time on this, but just to say that each dot represents one of the core factors that I've just talked about. And you can see that there are actually some key sensitive periods that happen throughout. So it's not just once baby is born. There's actually a lot happening in preconception, pregnancy, and just before or after birth. And often that's a time when people are thinking about other things. Obviously the birth process, getting baby home, but there's actually some very sensitive sort of situations happening here that we can help support you with. Um, And so one of what we're actually experiencing on the day to day may be a reflection on some of those key factors needing extra support. So for example, if you're having trouble conceiving, that can often be actually a microbiome issue. A sperm microbiome issue or a vaginal microbiome issue is very, very common. And so for each of these challenges, we are wanting to provide you support. And we look at the core factors, but then we also just want to give you some practical support so that we can reduce stress and create positive experience. And these things don't happen because you don't know stuff, we haven't been making an effort. It's just, once again, that reproduction requires a lot of resources. And having support and information is very helpful in navigating these things. And so the aim is to prevent them if possible, or have the resources available for repair if things don't go to plan. And once again, we sort of see some common challenges with babies. You may recognize some of these things in your own child if you've had a child already. And once again, some of these things are preventable. And you may not know that there are things that you can do earlier on that may actually prevent these things from happening or support your child so that they don't become too much of an issue. Okay, so I'm going to take you on a journey now from preconception to your child's second birthday. And I'm just going to highlight some of the many things we can do to support your child at this time and the types of resources and offerings that we have developed. Keep in mind that the aim of the program is not to be perfect, but to develop a deeper understanding of everything you can do for your child and also why you are doing it. So we want to make you feel confident and empowered in your journey. So preconception and trimester 1, this is the first timeline we're going to be talking about. What are the most important things? So I would say definitely having a healthy microbiome. And if you aren't sure what your microbiome is doing, because a lot of people, would just assume that everything's going really well. But some clues that things aren't going well would be if you have chronic vaginal issues, so like discharges or vaginitis, or if you have like a lot of gut symptoms like bloating, diarrhea, or a tendency towards constipation. In the first trimester, in preconception, we really want to be trying to get on top of these issues. And I would recommend further testing if you have any kind of inkling that things might be going wrong. keeping in mind that things might seem fine, and sometimes there can be underlying things going on in the background. So we're always encouraging people to do as much as we can for their microbiomes. And one thing that you may not know about is that having dental issues or oral microbiome issues can also predispose you to things like preeclampsia. So in our preconception module, we're really kind of addressing all of these different possibilities and helping you kind of get on top of them if you need to, and giving you some suggestions for further testing and so on. We're also focusing on detoxification. Now, this is definitely more related to preconception than trimester 1, but just keeping in mind that people will often go from preconception to having a positive test very, very quickly. So you do kind of need to be very aware of that when you are detoxifying, because you don't want to be, inadvertently putting your new baby at risk. But we do have a lot of resources within our preconception module to kind of prepare you, because once you're in trimester 1, it's not a time for detoxification, but ideally you would have had some gentle strategies and some things that you've done prior so that you can be prepared for this time. So nutrient repletion is a really, really big one. So if you are currently doing a preconception care, this is a great opportunity to do more than just take a prenatal. You just need to know that something you will need more of, and things like iodine, folate, and iron, for example, do take a little while to build up stores. And depending on your specific requirements, you may actually need more or less than what's in a prenatal. So I do recommend having a look at our resources to kind of get an idea of what would be most helpful. We often see a situation where mums will suddenly become pregnant and then they're not wanting to eat and they're quite averse to foods. So we want to have those initial stores quite well built up. We just need to keep in mind that in trimester 1, that's when most of the organ formation happens. So that's a reason why we want to have those nutrient stores well prepared. And then the other thing is just having mental preparedness for the journey. And so, we talked about all of these things that are really helpful to do, but having any kind of stress in your life or any kind of I guess if you've been partying or having a lot of other things going on, it's helpful to know that there are things that you can do to actually really kind of repair trauma and long-term oxidative stress. So, for example, meditation has been shown to help lengthen telomeres, which is really helpful if you're going to be, obviously passing those on to your offspring. So yeah, there's a lot of things you can do to prepare. And that's one of the major benefits of our membership, is that we've sort of highlighted all of the things in stages that are and made it quite accessible, so it's not overwhelming. So I'm just going to quickly go through this. Some of the common scenarios we see in preconception and pregnancy is that mums will be taking a prenatal, but they actually may not be addressing all of their nutrient needs, whether that's from diet or they aren't actually getting exactly what they need to build their levels up. Because you have to remember that when you start your pregnancy journey, you might be feeling great, but obviously pregnancy takes a lot. And so, but towards the end of pregnancy, that's when people really start to feel it. And so we'll often see people having to have iron infusions, which can be helpful. But we don't really know. There hasn't been enough research to really show what the effects of iron infusions are for the baby. And I think depending on when you get it, that can potentially be a little bit inflammatory. So ideally, you'd be avoiding having an iron infusion if possible, but obviously they do have their time and place. But you want to have your iron stores built up earlier if possible. And another common thing that happens is mum will get an infection during pregnancy. And one of the things we really like to do in our program is to give you resources and tools to help nip any infections in the bud, treat them naturally if possible, and avoid antibiotics if possible, because that will promote less inflammation and a healthier immune signaling in the body. And so there's other things we're also trying to really reduce the risk of pregnancy complications as well. And there's lots you can do in preconception and throughout pregnancy to reduce your risks. And yeah, so that's also in our program as well. So just a quick slide on detoxification in preconception care. We don't recommend any detoxification once pregnant. And ideally, I guess the main thing I'd like to sort of pass on from this slide is that if you are aware of having, heavy metal load, or you've had a lot of toxin exposure for whatever reason, taking as much time as you can in your preconception phase is a good idea. But I am also aware that some people are quite keen to get started on their family. So it is helpful to do some detoxification before you fall pregnant. But then also if you know that you do have some, I guess like a heavy metal load of some sort, there are some things you can do to protect the baby once you are pregnant. But yeah, in terms of detoxification, we do go through a lot of strategies for toxin reduction and detoxification in our membership. And this will how toxins affect you will also depend on your genetics. So that's something that a lot of people like to kind of get an idea of. And there's a lot of different genetic tests you can do now, and some of them are targeted specifically for pregnancy, which is quite helpful. But we just want to sort of see, if there are a lot of extra needs, because certain genetics will require extra needs for detoxification. So that's something that's an option for you if you are in that preconception phase and you kind of want to get as much support as possible. You can get some genetic testing done. And so there is, I might actually pass on to Lisa for this one, if that's okay.
Yeah.
Just with her experience.
Yeah. So this is my gorgeous little baby who is now 15. But when she was born with congenital heart disease and a very specific sort of congenital heart disease called DORV. And if you look in the little blue table, you can see listed DORV, which means double outlet right ventricle. And you can see it's linked to something called retinoic acid. So retinoic acid is Roaccutane, so the medication that you take for severe acne. And I took this 7 years before I actually conceived my daughter. So would never have thought that I was putting my unborn child at risk at all. But I didn't understand my SNPs when I got pregnant. I didn't know anything about this. And essentially, she was born with this thing, DORV, which has meant that she needs open heart surgeries for the rest of her life. Um, and it's obviously it's obviously a very sad story, but she's totally fine now. But I still wish that before I got pregnant, I understood my SNPs and I understood that, my liver clearance pathways weren't as good as they could be. And I could have optimized my methylation and I could have done more detox before I got pregnant. And her life would have turned out very differently. So it's a bit of a dramatic illustration of the fact that I did no preconception care and I had risk factors I didn't know about. Thanks, Sarah.
Thank you. Okay, and so just some of the things you can do if you are in the preconception phase, and this is something that we go into a lot in our program. We will give you specific resources for all of this, but just a bit of a summary here for you if you are in preconception and wondering about how you can remove toxins from your body. I recommend just starting with the basics, so removing exposure. The most common ones are plastics and fragrance, so artificial fragrances. But then obviously, if you're taking medications, alcohol, just kind of definitely finding some alternatives, reviewing your medications if there are sort of better options for pregnancy, things like that. And then the main thing with detoxification, because obviously our bodies are designed to detoxify, and they do, and we'll see that time and time again, and naturally detox things. But it really depends on your nutrient levels and also on how often you're going to the toilet. So sometimes people will think that they have daily, like really regular bowel movements, and they might be going every day. Sometimes you can still have quite slow bowel transit time. So we kind of run through all of the things that you need to be aware of within that space. And ideally, you'd be having like a bowel transit time of about 24 hours, and that stops things from reabsorbing like excess hormones and toxins and things like that. And so you can see here, like obviously the really basic things like lots of protein, good hydration, gentle sweating. I'd also say a lot of fiber. And then there are some things that you can eat that actually support your liver detoxification as well. And we do give some extra suggestions in our program. And so, on the topic of resources, I have covered a lot of the preconception sort of stuff in the last couple of minutes. But I just wanted to kind of draw your attention to the resources for trimester 1. And remember, this is a period of major organ development, so most of your baby's organs will be developing in this first 12 to 14 weeks. So we will give you lists of safe remedies for common ailments, so you can sort of safely support your body without causing any having any risks or causing any stress. We really start to work on the vaginal and microbiome, the gut microbiome in this first trimester, because it will be easier to manage if you start early. And we kind of start getting you thinking about support teams and give you some food suggestions as well, because this is obviously often a time that's a lot of nausea, feeling sick. So we will give you some specific remedies and food suggestions to help with this time. Okay, so moving on to trimester 2 and 3. So this is often a time when mums will start to feel much better. And in a way, there is some kind of complacency that develops at this time. And that's just, I guess, there's nothing really wrong with that. But I think it's important to realize there's so much going on in this trimester 2 and 3. And I think the focus will often be on setting up the baby's room, hospital bags, that sort of thing, depending on your journey, of course. But there is just, it's helpful to know there's so much going on. And we have a few aims in this second and third half of part of the pregnancy. Obviously, we've talked about preventing and treating infections quickly and safely. So that's something we're really focused on. We really want to protect your microbiome health and support it, because it will change. It does change during a pregnancy, and we want to make those changes positive. And then there will be trimester specific support. So each trimester you sort of see common sort of themes emerging. In this third trimester, that's really when people who originally maybe their levels of things like vitamin D, iron, or the diet was going really great. This is where your needs actually really kind of increase, especially things like calcium, which is often an under sort of resourced nutrients. So, we really have to look at dietary intake at this time, because it can cause things like cramps in the mum, and it will have an effect on the baby. So if you're having a lot of sort of symptoms in this time, it's the body telling you that, potentially there is something amiss, and there are potentially some things you can do about that. We're also really focusing on reducing pregnancy risk factors and preparing for breastfeeding. So we're just sort of doing a really slow lead up so that you feel prepared, and not sort of things aren't getting rushed right at the end. So one thing that will often come up in this time is hyperemesis gravidarum, or otherwise known as HG, which is when pregnancy nausea or vomiting extends past that first trimester, and it can be often quite intense. So HG is known has severe persistent nausea and vomiting, and it can be associated with dehydration, weight loss, electrolyte imbalance. And I think, really what we see is like a lot of nutrient deficiency developing as well, because obviously it's pretty hard to eat. Um, One of the things that you may not know about is that there is a higher prevalence of H. pylori in women with HG. So there are potentially some things that you can do to reduce your risk earlier on. That could be potentially one of the tests that you get done, especially if you have had HG in the past, because any woman who's had HG before is probably not, desperately trying to avoid that in the second pregnancy or third pregnancy. So that is a possibility. And we talk about quite a few different pregnancy risk factors and complications in our program. So depending on if you've had one of something like that, like preeclampsia or gestational diabetes, there are some, or HG, there are some specific things that you can do to support yourself and potentially reduce your risk of these things happening. And one of a really important theme of the third trimester is actually to reduce allergy risk, because the second and third trimester is a really important time for immune signaling. So keeping in mind that the immune system develops based on mum's immune signaling. So you can see from this list that there's things you can do right from the get-go to reduce allergy risk by promoting healthy immune signaling. And there's things you can do throughout the whole journey. So having your own really good microbiome early on, having a well-diverse microbiome, having a healthy vaginal microbiome, and then optimizing conditions so that you can have the best possible birth outcomes and the best breastfeeding journey as possible, because all of that is actually really helpful. A lot of research to show that that really does reduce allergy risk. Something that you can do if you're already in the third trimester is definitely to have a look at your vitamin D levels or second trimester. Make sure they're quite high. And you could potentially also start taking a probiotic like LGG, which has also got some research to show that it helps reduce allergies in the infant. And we've talked a bit about optimizing your microbiome during pregnancy. So what does that look like? I'll just kind of go through a quick little list. So one thing you can do is aim for 30 different plant foods per week. So that can be, anything from rice to chickpeas to carrots. It also includes herbs, spices, nuts, seeds. And that really has been shown to increase microbial diversity. So that equals resilience. The second thing is to eat some specific foods, prebiotic foods. So things like garlic, onion, leeks, asparagus, oats, legumes. So if you're not eating any of those foods, you could potentially add some of those. And garlic is one of the herbs that are often used to help in most infections, actually, in pregnancy. It's very safe. It's very antimicrobial as well. You can also include fermented foods. So sauerkraut and kimchi, just add that to your dinner. And we have talked already a little bit, we've sort of touched on reducing antibiotics if possible. That is a really, really important thing you can do to help promote a healthy microbiome. And then the other thing you can do is just get outside daily, get a lot of exposure to soil, fresh air. So gardening obviously would be a good option. So just getting out into the elements, and gardening has been shown to be really helpful for microbial diversity. And the other thing is just managing your stress. So keeping in mind that stress can be so prevalent in society that we just think it's quite normal. So it's helpful to have stress reduction strategies, especially if you're quite busy or if you've got other kids at home, because stress does alter the gut. It makes it more permeable, and it does impact how the microbiome forms as well. And so a common thing that people will want to know is whether it's safe to take paracetamol, because it has got a bit of a reputation for not being the best. Lisa, do you want to kind of do a little summary of
Yeah,
paracetamol?
sure. So if you've asked your obstetrician or your midwife, is it safe to take paracetamol when I'm pregnant? They will have said absolutely yes. And they say that because it doesn't cause birth defects. So unlike the Roaccutane I talked about earlier, paracetamol will not cause birth defects. So that's great. But it does cross the placenta. And the studies around safety that have been done were studies that in infants were studies that lasted for 48 hours or less, and they only looked at the liver. They didn't look at anything to do with brain health or any other aspects of development. And if you dive into the research, you will see there are plenty of studies that show there are links between paracetamol use in pregnancy and then ADHD and autism. So if you need to use it, use the lowest dose for the shortest duration, but also have a think about why you're getting headaches. So, is it because you are working too hard and under too much stress? Is it because you need to see an osteopath and have some realignment done? Are you actually dehydrated? Are you not getting enough sleep? So, yes, if you've got splitting headache, use paracetamol, but then consider what you can do the next time.
Great, thank you. Okay, so just a summary of the trimester 2 and 3 now. In trimester 2, you're doing a lot of blood building. Immune signaling is really important. And so we've got a list of some resources that we would have in our membership. And then in trimester 3, the important things is that, well, I guess one of the things is nutrient levels can sort of start to drop. The immune signaling is very, very important at this stage. So reducing interventions as much as possible. And neural pathway is just before birth, a very, very sensitive time. So there's quite a lot of things that we sort of support mothers with in the third trimester. And that's just a list of them there. Okay, so in our third stage is baby's first year, and keeping in mind that I'm just sort of mentioning that as one stage, but in the actual membership, we sort of break it down into, I think it's month by month, or yeah, there's quite a few modules within this first year because it's such a big year, so much going on. And the main thing is, from my perspective, I would say, is that the infant microbiome starts to develop from birth. So it's seeded during birth and then it starts to take shape. And so this is a very, very sensitive time for things that can sometimes, there's some things that you can do to optimize that, and there's some things that will sometimes happen that will really disrupt that. So no matter what happens, ideally you would avoid the disruptions if possible. But if the disruptions do happen, we just need to kind of do some repair work. It's not the end of the world if you need to have a cesarean, for example, but there is a lot that you can do actually to make sure that we sort of shift that microbiome and make sure that it's really promoting tolerance. Because the main thing is that we want to be able to prepare the baby for introducing foods. And so sometimes when there are a lot of disruptions, what I see is that parents will often find that their kids are reacting to foods. So we'd really try to avoid any kind of disruptions as much as possible, and we really go into a lot more detail in our membership. And the other thing is that the senses are developing. So there's quite specific things you can do. For example, baby wearing is a really helpful thing to help support their sensory development. Because we do see a lot of kids that have sensory sensitivities later on, things like that. So there's a whole sort of module focused in our first year on how to promote healthy sense development and integration, so we can support bubs as much as possible. And then you'll see there's a lot of immune support going on. We're introducing solids. There's a lot of things that we do, specific things that we do to help support mums, and we sort of will really lay that out in a really accessible, easy way, so that if you are at that stage, you can just access the resource and have the most up-to-date advice there for you. And then, of course, not to forget mum, because a healthy mum is obviously going to be the best possible situation for baby, because we want you to be feeling well, healthy, and with as much support as possible. So there is a lot of postnatal care that needs to take place, and we really do try to give, we will try to give as much support for mum in our membership as well. So just a quick summary of some of the things. I won't actually go into all of these, but I will just kind of mention the common pictures. So often in the first 6 months, um, uh, people will say, that the baby is crying, it's fussing a lot. And this will often lead to mums thinking that they don't have enough milk in breast milk. So that will lead to formula top-ups and sometimes medications as well if the baby gets a diagnosis of reflux. I think what you need to know is that reflux is very uncommon and it's low milk supply is also quite uncommon. Um, and there is a lot that that could be going on other than that. But what we often see is that the common outcome is that formula top-ups will come in, and then the true low supply will develop because it will take over from breastfeeding. So there is it's such a intense time because parents are often not sleeping, they're second guessing everything that they see. But we have curated some really helpful support to help you at this time so that you can kind of follow a plan and kind of really get to the bottom of what's going on without sort of having to second guess yourself or kind of going down the wrong diagnostic pathway. And one of those is that parents will often think that their baby is reacting to everything they eat. Once again, it could be that the gut maturation has been disrupted a little bit and there's a bit of an intolerance, or it could just be that the baby wants to be picked up more or it's requiring a bit more sensory input, so from things like baby wearing. So, because that will also cause them to cry and fuss and look like they have gut pain. So there's a lot of sort of things to navigate at this time, but I won't go to all of those. I'm just going to go through now just some of the supports that you will be getting. And you can see there's quite a big list, but we're really focused on feeding support. So aiming for breastfeeding, and if that doesn't work out, then we do have some suggestions for formula. Um, then we've got a whole section on sleep, what to expect, and helpful tips. We've got a whole system on baby immune support, eczema, allergies, mum's health, and then, like I said, the colic reflux infant gut picture, which is a really, really common picture. And we creating a roadmap to kind of help you identify what's actually what's actually going on, so that it's and giving you some suggestions for how to deal with that. And then from the 7 to 12 months, I guess the main thing is really introducing solids, and that can be really straightforward for some people. And if the child has allergies or eczema, it's not straightforward. But we do really help with that, what to give, how to give it. And we also help with sleep at the later stage because sleep in early infancy is a little bit different to sleep a little bit later on. And we've got a whole module on sensory foundations and feeding development and really helping. I guess our aims here is just support the immune system, support sleep, and support the oral motor sensory system as well. So that's to help reduce fussy eating and things like that. And then in the second year, this is where the integration and the regulation really starts to take on what you've kind of done in the first year. So the main things we're looking at is just helping to support their growth, their regulation, their sleep. Very commonly, we'll see kids at this age with gut issues, so constipation, really, really common, or eczema flaring up. And just keeping in mind that this is a rapid time of brain growth and language explosion. So, and what we're seeing during this time often coincides with some pretty big changes in the child's life. So they might be starting daycare. So very often they're finishing up breastfeeding, or they might have dietary changes. So, and then another thing that often happens is a new baby will come along. So this can be quite stressful for some kids. So just that shift can be a big sort of change for them. at a time when actually a lot is still going on. A lot of development is still happening. And I would say the main thing that to be really aware of at this time is just to have that, just to realize that the child is still calling for looking for safety signals, and the main thing that you can do for them and in this at this point is be a really responsive parent and just be very present. And it's not about being perfect, but just realizing that their brains are still developing and they have still very much in need of safety signals to help ground and regulate their nervous system. And so the way that we're going to support you at this time is once again look at revisit nutrition, because like I said, the diet will often change. Revisit gut health. We're sort of looking towards eventually helping with getting toilet trained. Once again, revisiting stress and sleep, because it will present a bit differently at this age and the needs are a little bit different. And then we also look again at just what's happening in the family and how to support their immune system naturally. And if they have got eczema and allergies, the best approach for this age group. And so this is the last 6 months of modules where we'll be going over toileting, sensory integration. If your child is fussy eating at this stage, there's a lot that you can do. And then we're also looking at airway health, which is something we see a lot of in our practice. Preparing for childhood. So that really kind of covers what we commonly see. So guide to worming, lice prevention, treatment, treating common skin and gut infections. And that's just really having like a naturopath in your pocket for all those common acute childhood infections. And then we also do help with speech and development as well in one of our modules. And that's all from me.
Cool. So now I'm going to dive into the detail of the 1000 Days Journey membership a little more. We really want to support parents. So we get feedback all the time that, being a parent in this day and age is very overwhelming and people feel very unsupported. They get lots of contradictory advice from professionals. Symptoms are just said, well, that's just normal. You have a baby, kind of that's just life. And there's often no sort of long-term support or ongoing care. So that's why the 1000 day journey as a holistic, continuous model of care can make such a difference. And we don't just want to give you a download of information because that's the last thing that you need. We really want to, as Sarah said, we want to be like your little naturopath in your back pocket. So whenever you need help, we're there. And so to ensure we're doing that, as part of the membership, you get 20% off consultations from the day that you start for as long as you're a member. We have monthly live masterclasses, so that's going to dive into, each month a different topic. So from fertility, pregnancy, gut health, immunity, lots of really practical, evidence-informed information. And we're mums. Everybody in our practice are mums. So we're not just reading the textbook and telling you what to do. We've been there and we've lived it and we know what it's like to be in your shoes. So to make sure we are that pediatric naturopath in your pocket, we have monthly live Q&As. So that's like a group consultation. So you join us on Zoom once a month, you bring your list of questions and we will answer them and have a chat to you about your concerns are. There's other people on the call, which means that you also get to learn from their questions and answers as well. One of the things that comes up is people just say, well, what do I eat? I've been told don't eat this, don't eat that, but what do I actually eat? So we'll give you recipe books, which will be either fertility meals, what to eat when you're pregnant, baby's first foods, all of these sorts of things. And lots of ready to use handouts like checklists, trimester guides, solids plans. So we're all about making sure that we prevent issues and you just don't have to go it alone. Because we are all qualified practitioners, whenever you have an appointment with one of us with your 20% off code, we can talk about what extra testing may be useful for you. And that might be things like a hair tissue mineral analysis, microbiome testing, genetic testing, or it might even just be blood tests and understanding the results of those blood tests. So rather than doing blood tests and having really low ferritin or really low vitamin D, we'll be able to pick up these deficiencies and treat them early on. So personalized data leads to personalized care. So the next few slides, we've just got some pictures just to show you the resources that we're going to be including. And these are added monthly. So obviously at the start of the membership, there will be a few of these, and then every month you get a bit more, and that's so that you don't get overwhelmed with information. But those guides are really popular with clients, like starting solids, avoiding dust mites. So why do we want to do this? Why do we think this approach works? So it's about empowering you to actually understand what's happening and to get personalized strategies and to help you build your trust in your intuition and decision making with us there to support you in doing that. So we've been doing this for a long time. We deal with families like yours every day and we get great results. So we help, people clear their child's eczema after having it for years. We help parents get a full night's sleep after struggling with colic. We deal with extremely fussy eaters and help them expand their repertoire of food. And we deal with a lot of behavioral issues like um, mood swings, aggression, all of those sorts of regulation issues. So again, we're not just reading this from a textbook. This is what we do day in, day out, every single day. So this program or this membership is for people who are planning a pregnancy, or if you're already pregnant, or if you've got a child under the age of 2. If you want to go on this journey in a natural, holistic way and get support to do that. And if you want to really set up your child for success, like we saw earlier about premature boys being at higher risk of cardiovascular disease. So to think addressing something before your baby is even born is going to affect their lifespan. So as I say, we've got the monthly masterclasses, we've got monthly Q&As, we've got lots of helpful resources, meal plans, shopping lists, food swaps, all the things. And the normal price for this is $49 a month, but for the first 50 people, it's only $29 a month. So you can join now as a founding member and get this price of $29, which is $29 a month. As long as you want to be a member, you stick with that price. That's only for the first 50 people, and then it will go up to the normal price, which is $49 per month. Our first masterclass is on the 23rd of March, and the first Q&A is on the 9th of April. But as soon as you sign up, you get the coupon code to get 20% off consultations. So you already get nearly $50 off your first appointment by spending that $29. And you get immediate access to some of our resources, such as our Eat, Sleep, Poop webinar, how to choose a prenatal supplement, and some handouts just about the science behind the 1000-day journey. So that is the QR code to scan if you would like to get started. So thank you very much for joining us for this. We hope you've got a lot of information out of this that you can get started on. And we hope we've just really shown you how many touch points a naturopath can have on this journey and ways that we can make this journey easier for everybody. So thank you. And thank you, Sarah, for taking us through all this information.
Thanks, Lisa.